Aye. Daryl, I will let you take the floor.
Okay, well, I had asked that this item be put on the agenda for special meeting at this time. I went back and I looked at the various prior iterations of the joint venture agreement that created Greenbelt Healthcare, and way back to the original back in 1998. And one clause that was never modified, even though the original 1998 agreement had been modified in 2001, 2005, and then again in 2018. One of the clauses that had never been modified was what it would take for a member to exit the agreement. And in that 1998 joint venture agreement, section 1, subparagraph D, titled Withdrawal of a Party, it states, a party may withdraw as a member of GHC effective at the end of any fiscal year, parentheses June 30, by giving notice of such intent to the other parties at least 180 days prior to the end of said fiscal year. And I know the board's been hustling to try to address and cope with the notice that was given by the city in February, and I think that's what the board was intending to do was trying to put this together in the event that it could be done. Something could be done by June 30th, but it was becoming apparent that nothing. It was going to be difficult to make this transition, given the untimely notice that I believe the notice was given to the county on the 27th of February of this year, which
Correct.
was less than 180 days. So I asked that that motion that was passed back in March by the board be rescinded, given the fact that the action is not necessary for this fiscal year. Then it would give the county more time to plan that transition. It could take place, at any time that some solution could be put together, but it's not necessary that the board scramble to put it together by June 30.
Okay.
That will definitely give us more breathing room, and I think it would help for a smoother transition, because I totally agree there's a lot of other options out there we want to look at and just don't have the time to pursue. So so I would entertain a motion.
I'll make a motion upon the advice of the county attorney to rescind the motion to move Greenbelt Healthcare to the auspices of Hardin County. Would that be?
I'll second.
Okay. Any other discussion? Julie?
What are some other options? What options are there?
Well, there may be the option of finding another owner that would allow us to let them remain as they are, as an independent nonprofit organization. Also, with close to 30 employees, making that transition to the county. Also, possibly depending, on what the Board of Health wants as far as the services that are provided. There's just a lot of things that we're still kind of in discussion, and we just I'm not ready to make that decision or make that move at this point in time.
I, as the county's representative to the transition team, there were just things that Board of Health Chairman Hoffman would agree that we're having to do that I don't think we're able to give the due diligence that it needs to be the best it can be for Hardin County residents in such a short time. Being without an administrator right now doesn't help the situation either. Jeff has been the number cruncher, getting stuff from the remaining staff at Greenbelt, but crunching that and putting it together, I don't think gives us the best outcome at the moment. So I think we need to do it right. The Board of Health has really taken an interest in, looking at this as it goes forward. So I think slowing things down and doing things right to benefit Hardin County residents is important right now.
Dave?
Is the county still looking at contributing funds so as to enable Greenbelt to offer an enhanced benefit package to the employees? Effective July 1.
I guess we really haven't had that full discussion. Actually, we haven't decided the cost for the healthcare package for our own county employees yet. So we have those discussions to hold yet. Yep.
But
So,
they wouldn't be county employees come July 1. You were just asking.
Right.
Yes,
How
this all started, I think, with a request from
Right.
Jimmy for contributions from
Right.
the owners so as to enable them.
yeah, and we
provide
haven't.
better, healthcare benefits.
Yeah, and we haven't discussed that at all yet. Julie?
So if the city withdraws, from my understanding, they needed an entity to work on
Right, that's right. Once
And so what will happen come July 1st if the city's out?
they won't be out July 1st of this year. They could give notice July 1st of this year with their exit date being June 30 of 2020. So this
But that would depend on whether or not the city still chooses to withdraw.
well,
Is that how that,
the
is that how
agreement,
that will work?
the agreement said they had to give notice 180 days prior to June 30, which would have been roughly June 4, June 3, or January 3 or 4. And they did not, so they're stuck remaining to June 30, 2020 under the
Okay.
agreement.
Okay, great, thank you.
But if some other solution were put together sooner, I'm sure that, something could be worked out and they could be released. But right now, it was just putting too much pressure on folks trying to throw it together.
I see.
Well, a concern that's also been voiced that I thought may be behind this action today was the concern was whether this would effect a change in the nature of the entity such that their old Medicare and Medicaid reimbursement number would change. If the entity changes, as I understand it, there may need to be a change with respect to CMS and their
Yeah.
identity.
I think Jeff could probably address that.
Yeah, we've looked at that, and even though the numbers may change, it seems that it's going to be it would be a smooth transition to go from Greenbelt home care to the county. It's like a 20-day, and it's all electronic. We've got a lot of paperwork, but it's CMS has talked with Greenbelt home care and said that it's not an issue for that to happen. So just some hoops to jump through.
Anything else? Any other questions? Okay. All those in favor, say aye.
Aye.
Aye. All right. Any other business? Okay.
I'll make a motion to adjourn.
I will second.
All those in favor, say aye.
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 Aye. Thank you, Lance.